My name is Martha Aguilar. I chose to write about a flesh eating bacteria known as necrotizing fasciitis. Warning: viewer discretion advised, not for the faint of heart. This is necrotizing fasciitis. Just kidding. This is actually a severe case of necrotizing fasciitis. As I said before, necrotizing fasciitis is also known as flesh eating bacteria. But that's actually a misconception because in reality, the bacteria isn't eating the tissue. This is a bacterial skin infection that spreads rapidly and destroys the body's soft tissue at a subcutaneous level. This can also be paired up with toxic shock syndrome, which is also deadly. This rare but deadly skin bacterial infection is caused by more than one type of bacteria. The bacterium is caused by group A streptococcus, which is the most common, and it's the same bacteria to cause strep throat. Other bacteria can be Streptococcus pyogenes, Staphylococcus aureus, E. coli, even Aeromonas hydrophilia, to name a few. This disease is separated into two types. Type 1 consists of polymicrobial because it has a variety of organisms, or type 2, which is a monomicrobial because it's only caused by a single infecting organism. Type 2 infections are caused by group A streptococcus and staphylococcal species. For the most part, it's a moderate, but there are times in which toxins produced by these bacteria execute the tissue they contaminate and cause it to die. Since the infection isn't being eaten, the bacterium destroys the tissue that forms. It can start through a small paper cut, a staple puncture, or even a pinprick. It can even go through damaged skin like a bruise, blister, or abrasion. It can even come from a major trauma or surgery. In some certain cases, we really don't know what's the obvious port of entry. Necrosis is the death of body tissue. It happens when there's lack of blood flow to the tissue. Unfortunately, this is irreversible. It's caused by factors outside to the cell or tissue that fall into the abnormal digestions of cell elements. Apoptosis is a programmed cell death that usually provides helpful outcomes to the organism, while necrosis is fatal. When the cells die, they go through different receptors that activate the result in the loss of cell membrane reliability. This then triggers an inflammatory response in the nearby tissue, which is blocked by phagocytes from detecting and getting rid of dead cells by phagocytosis. Then debridement takes place, which is removal of the dead tissue. And treated necrosis develops an enhancement of deteriorating dead tissue and cell debris around the site of the cell death. The fascia is a white sheet that covers the muscle, thus creating necrotizing fasciitis. Once inside, the bacterium goes right underneath the skin and attacks the fascia. The bacterium enters the skin through a cut and uses the fascia as a reservoir and begins to reproduce toxins and enzymes. It then replicates and spreads rapidly around the fascia. Both their body and the bacteria are destroying the tissue. That causes the tissue to swell while sending different cells and substances to the location of injury called inflammation. There is a certain substance our body uses which is called clotting factors. In this case, the clotting factors happen to overreact and shape many small clots that block blood vessels. Together with swelling, it shuts down blood supply. With that being said, the lack of oxygen and nutrients, the tissue begins to die instantly. This tissue also causes the body to go into systemic shock, resulting in organ failure. Some signs and symptoms can occur within 24 hours of infection. It can start off with a minor trauma, not appearing to be infected. Some pain may present not only at the site of injury, but the region or limb. In fact, the pain starts to generate as a muscle pull with excruciating pain. Then you experience like flu-like symptoms such as diarrhea, nausea, fever. You'll also become dehydrated. You'll also be confused on why you have so much pain over a small cut. Other symptoms can occur within 3 to 4 days, like swelling of a limb and a purple rash. The limb would then have darker blisters filled with black fluid with flaky appearance. Serious symptoms would be your blood pressure dropping immediately, causing the body to go into toxic shock due to the toxins that the bacteria is giving off. which would then cause you to become unconscious. Since the symptoms are very similar to the flu, many do not seek medical treatment until it's too late. Some treatment and prevention. Treatment for necrotizing fasciitis can be through strong intravenous antibiotics, including piperacillin, vancomycin, or clindamycin. That's administered during the first line of defense. The reason behind it is because the bacteria toxins destroy soft tissues and condense blood flow, causing antibiotics and not being able to reach all infected areas. In other severe cases, amputation will take place. Prevention, the only thing to prevent from this is keeping up with the personal hygiene. Washing your hands as much as you can. When coughing or sneezing, cover your mouth and dispose of tissues. Um, Keep making sure you're sanitized and stay away from those who have sore throats. Odds are, if you have a strong immune system, take care of your wounds properly, and maintain a good hygiene, chances are low to get it. Thank you.